late, and I apologize for that, for those of you that are listening in. We're waiting for a few of our people to still arrive, I think. We're here at the Scientific Lab today in Albuquerque. But let me go ahead and call to order the New Mexico Department of Health Facilities and Los Lunas Community Program Governing Board on Thursday, October 18, 2012. And the first order of business is to establish a quorum, and we'll do a roll call here and see who we have present. And I know we have a couple people still coming, but let me go around the room and, for the record, we'll establish who's here today. I'll start to my right here with Dr. Adams.
Richard Adams, Chief Medical Officer.
Gail Nash, Chief Nursing Officer.
Louis Trujillo, Clinical Performance.
Donna Deason, Administrator, Fort Beard Medical Center, New Mexico State Veterans Home.
Okay.
Tomas Lopez with the New Mexico Public Education Department.
Tomas.
Rick Crispin, Administrative Services.
Kelly Thompson, Office of Facilities Management.
Janie Davies, New Mexico Rehab Center.
Troy Jones, NMDOH.
Michael Gutierrez, Turquoise Lodge Hospital.
Rita Ward, Aging and Long-Term Services.
Anita Westbrook, Sequoia.
John Helabest, Los Lunas Community Program.
And Brad McGrath, Interim Secretary. I think we have a few people. Louis, I think you'll be representing, for voting purposes today, we'll have you represent Veterans Home.
Yes, sir.
Donna, you can represent Fort Bayard.
Okay.
We have a few people I know. Gabrielle is just arriving, so she's an ex officio. We also have, I think, Secretary Hale, I think was trying to make it today, but I spoke with him yesterday, but he may not be here today. And I think Daphne from CYFD is absent. Oh, she was trying to come.
She's on her way.
She still may be on her way. So that's quite possible she'll be coming in. So in terms of voting members, we have a quorum today. I'd like to welcome, well, in terms of new members, we have Gail Nash with us today, and she's our brand new CNO. Will be serving on the board as well. And I can't remember, Gabrielle, I should remember better now well, we're going to talk a bit more in a few minutes about who's a voting member and an ex officio and how we want to do that for credentialing. But I can't remember if the CNO is when we hired one, whether that would be a voting member or an ex officio member.
Right,
We'll have to take a look. I think it was too. Is the CMO also, I can't remember that, is the CMO a voting member?
Yes.
So Dr. Adams and Gail are both voting members?
Yes.
Okay, great. That helps with the quorum. But Gail, would you like to go ahead and introduce yourself and tell us a little bit about your background? You have to speak up because we're broadcasting.
Okay, good morning, everybody. Thank you so much for this opportunity to work among this group of fine members running the Department of Health. My name is Gail Nash. I'm the new Chief Nursing Officer. I have a background with acute care, some behavioral, a small bit of long-term in the Chief Nursing Officer role for about a little over 20 years. I've been a Chief Quality Officer for 3 years for the military, and I've been a surveyor for the Joint Commission for 11. I've learned a lot in my role in the last month with all of you in the room. You've been very patient, and I appreciate the time that you spend with me. My door is open, my cell phone is always available, and I'm here for whatever you need. And like I tell folks in the facilities, use and abuse me, because that's my job. So thanks for having me.
All right, thank you, Gail. Well, just some quick items here, as we do each month. I'd like to, as you take a look at the agenda for today, which is a pretty standard agenda, I would like to request a motion to approve today's agenda.
So moved.
Second?
Second.
All in favor?
Aye.
Opposed? Okay, the agenda passes unanimously. And also, just take a few minutes to do. And item number 3, when we say approval of the minutes of the previous meeting, that packet of minutes also includes in there the prior reports from last month. So I think that goes up to about page 14.
Yes.
So we'll take a few minutes to take a look at that. See if there's any questions.
Form Error, Brad and I see, I was not present at the meeting.
Okay, great.
Was present.
Kathy, did you hear that from Secretary Ward?
Yes.
Right, in spirit, but not physically
I was
there.
there in spirit.
Thank you. Any other comments on the packet from last month?
I'll make a motion to approve the minutes.
Second. All in favor? Opposed? Okay, motion passes unanimously. Thank you very much. In terms of new business reports, I'll start there. And one of the, well, we've had some changes, and I guess I'm still the chief facilities officer and the chief deputy, but now I'm also the interim secretary. So I guess I get 3 votes, but serving in that capacity right now. And in terms of that, in a couple of minutes, we're going to talk a little bit about some ideas for the governing board here in terms of how often we do the meetings and where we do the meetings, and just talk about that as a group. And in my role as an interim secretary, what I'm really trying to focus on right now in that role, in spending more time in Santa Fe and at the state capitol, and trying to get a better sense of other aspects of the Department of Health. I've been doing a lot of meetings. I've done introductory meetings, which is, it's nice to start using a little technology. I'm a little technology challenged, but it's great. I've done a couple of introductory meetings in our Reynolds Auditorium downstairs. Had about 150 people in person for those. But through our video streaming, probably another 600 or 700 people throughout the state, that have participated on that. And been sending out on a regular basis, and we'll continue to do that, DOH all email, so that I can communicate to everybody throughout DOH and get their input. And I encouraged everybody to feel free to contact me at my email address with any questions or concerns or ideas or suggestions. I've gotten over 300 of those so far, and with the exception of about 3, I've responded to all of them. And some of them 2 or 3 times, because when you do respond back, they respond back. So you have a little dialogue going. So that's been great, and they've all been very positive. They've had lots of ideas and lots of suggestions. Not all things that we can do. There are things that sometimes you don't have control over, like pay, things like that. We were at a meeting at SPO yesterday with Director Mosier, and a lot of that is state personnel office. So there's things that we can do within DOH, and there's some things that we have to work very collaboratively with SPO on. But we're going to continue doing those every month, like November 14th and 15th, I believe. I'm going to do another round of those, and do those every month. And I made a commitment to visit as many areas as possible. Facilities I'm more familiar with, of course, but areas like public health, DDSD, DHI. I did meet the other day. I know Gail and I were at a meeting here in Albuquerque with our surveyor group, our DHI, our licensing, and our surveyors. There was over 100 people at that meeting. Now, again, we got a lot of discussion, a lot of feedback from people. And we don't know. I know they'll be doing a nationwide search for a new secretary, but we really want to use the opportunity right now to just reach out to people and get their opinions on things, and look for opportunities to do a better job. We're also focusing on how we can do a better job with our customers. At our DHI meeting, for instance, we talked a lot about the people that we survey, the people that we visit out there and throughout the state of New Mexico. Presenting ourselves as professionally as possible, listening to their concerns, not just having a one-way dialogue, and looking for opportunities to help resolve issues in a more expeditious manner. I think sometimes things take longer than perhaps people in the field would like, so we need to work very closely with them on that. We talked a lot about vacancies in facilities and throughout DOH, and we're real committed to doing that. So it's business as usual, with the exception maybe we're just trying to look for opportunities to get a lot more input, I think, from everybody. And we'll continue to do that. So, that's pretty much the main change there. We are searching for a chief facilities officer, who I guess would also be a voting member.
Yes.
On the board here. I think we're very close to hiring somebody to be the chief facilities officer. So that person will be joining the governing board, maybe as soon as our next meeting, hopefully our next meeting. And so that'll be very important to do as well. That'll help us a lot with the facilities. So we have a lot of things going on at the facilities, and we'll talk about some of that today. I think that's the primary thing. Well, maybe this would be a good point to do that before we do the administrative reports. Gabrielle, is this a good time to talk about amending the bylaws?
Sure.
And what we want to talk about, get people's opinions on, is a couple ways. I think to make the governing board meetings meaningful to everybody, and everybody takes up a lot of their time, especially those of you that are gracious enough to participate that aren't with DOH. The way they were set up originally, we've been doing them monthly. We would have done our meeting this month at Fort Bayard Medical Center, which would have been great to visit, but with all the transition we're having in DOH right now, it's a long ways. And the farther away we go from Santa Fe, harder it is for people to attend. Although I think there's a lot of value, there's still a tremendous amount of value in at least, periodically visiting the facilities, especially places like Fort Bayard, which people don't get a chance to visit. We had formerly done quarterly meetings, and I think in terms of content each month, a lot of people were saying, well, they thought it might be more productive. Credentialing is something else we'd have to do differently, but in terms of the governing board meetings, I know several administrators have asked about the possibility of going back to a quarterly format as opposed to a monthly format, especially now as we come up on the holiday season and then the legislative session. We don't, once the legislative 60-day session starts, it's pretty much 24/7, I think, when that starts. So that was one of the things we wanted to talk about today. We also wanted to talk about, in terms of credentialing, Gabrielle had made me aware that if we really want to be, we want to be very careful on that. So as we're voting on credentialing, we have voting members, we have ex officio members, and the people I are quoting you accurately, the people that are with DOH would be voting on things like credentialing, where non-DOH governing board members would be more ex officio members.
Correct. And my concerns were to be able to provide the protections for the credentialing process that are allowed by law. And it is a responsibility that the board takes on and a liability that the board takes on when you're making those decisions to vote for who should be credentialed and privileged within DOH. And I just wanted to make sure the board members understood that and think it might be better if it's kept internal.
Right, then they don't have that concern as well.
Correct.
If we have an issue with a physician later on that we credentialed.
Correct.
So let me take both of those issues. The first one, and I'm fine with it either way. I know either way we'll need to work around the legislative session as we get to the spring. And then I guess there's a third question, where we should have them. We can have flexibility on that. We can have the meetings, continue to have the meetings either monthly or quarterly at facilities, or have a common area that we do the meetings at each month, like here in Albuquerque. So it's maybe a twofold question, but let's have a little dialogue for a minute in terms of whether there's more value in doing the meetings on a monthly basis, or would people feel that we wouldn't sacrifice any of the content or the importance of what we talk about in the meetings by going quarterly. So let me just maybe ask people's opinions on that.
Brad, my basic thought would be to go to a quarterly meeting. I think that would be, from my perspective, more substance in terms of the information provided, at least from our facility.
All right.
On a quarterly.
I want to encourage people, whether they're monthly or quarterly, we really do want to have substance. I think that's something we have opportunities to improve too. So you'd be in favor of quarterly?
Yes.
Okay.
Quarterly with a caveat that we have a provision for credentialing, that the credentialing committee
I believe we've had language, and Troy was going to pull actually some of that we could amend the bylaws so that the credentialing committee can act independently, and then it is announced and ratified at the governing body. But as long as we can do that every month, and we've done that in the past, then I'm good with quarterly. I think that really credentialing is the only function that has to occur more.
Which is similar to what we were doing before.
Yes.
I guess, historically, it's been quarterly, for the most
Yes.
part. That's primarily been the
Well,
history.
credentialing has occurred monthly
Right.
for a long time, but the governing body was always quarterly.
Okay.
And just for clarification, the governing bodies used to be individual of each facility, and so when you did that quarterly, you would have each facility lined up for 2 days.
Right, that's hard.
It's very difficult.
I do think there's great value in having a combined governing board where we're all sitting together and talking about everything is together in one group. I think there's great value in that.
I think the only one that it's a problem for, and it just only becomes a problem if the surveyor says it's a problem, but it's Roswell, because it's a CMS acute care facility. And the governing body and the regulations for hospitals under CMS talk about having a specific a sole medical staff and a sole governing body for the facility. So that might have to get tweaked, but beyond that, I think the rest of us are all okay because none of us are CMS hospitals except them.
Okay. And as Secretary Ward, from your perspective, with a very, very busy schedule, one of the other things I was thinking of with you and there are other secretaries and members that are attending. It's hard every month, especially as we're traveling around the state. So, do you have a preference for monthly or
Quarterly would be better for me, but that's selfish.
But I think it's important because if there's a better opportunity to have you attend, then it's really important to find a way where, like Secretary Hal, the same thing, where it's easier for him to attend. Although he may still come. I talked with him yesterday afternoon. It's just people have a lot of conflicts in their schedule. The closer we are to Santa Fe helps also with that. So, Michael.
I totally agree. I think quarterly would work better. I think it gives us an opportunity internally to gather data so that we can present at the meetings, and it's more substantive in the sense that we'll have a longer term to look at. When you look at monthly, you don't really get the big picture of what's going on with each facility. And I know that Ms. Nash and Louis Trujillo mentioned earlier before the meeting that they're looking at maybe strategizing to come up with a format so that we're all similar in a sense, so that we get a good dashboard look across the board. And I think that would be beneficial and speed up the meetings too, since we're going to be doing quarterly meetings. So I'm all in favor for that.
Okay.
Well, selfishly, I think semi-annually, add in NMDOH. Can't do that. I think given the weekly meetings that we have as facilities, it makes it where going quarterly, to me, it makes sense. And it's also, like everyone else has already said, it gives us the opportunity to do more and bring more to the governing body. But with the weekly meetings we're having, everyone stays in touch. We're on top of our topics and issues that are going on. So I'm in favor of that. And a centralized location would be nice. NMDOH is centralized. Very close to where I'm at.
We do have weekly facility meetings, so on the phone or in person, with all our staff in Santa Fe and all the facilities. Every single week, almost every single week, we have usually about a 2-hour meeting where we go over contracts and provider agreements and just any topic that vacancies, anything that may come up. So we are engaged a lot more than we were. So that's real important.
It is.
Okay. Janie?
I think quarterly would be better. Like they said, it's going to be more substance in the reports. And I think for our purpose that Anita was talking about, the weekly meetings, because what they really want to see is the oversight of the facility. So.
All right. And Rick, I guess from 2 points, we also have a finance group, or they meet, and I think that's incorporated in now into your ASD, your area, as monthly meetings, by in person and on phone, call in, with all the divisions, I think, in DOH, right?
Right.
Including the facilities.
Right, yeah, we'd be meeting telephonically with all the fiscal people for the various facilities. And one other thing, we'd be saving some budget.
Right.
Mm-hmm.
Always thinking about
decreased travel costs.
So you're...
There is a comment from Ruby Ann from
Sure.
the
LLC.
Sure.
She said it would be good if more facilities data was presented, as wasn't the case from the previous quarterly meetings.
Right. And I think there's opportunity for us to do that as well. So I agree with that. So we'll look at doing that as well, okay? I agree with that. So I guess, Rick, are you okay with
I'm
quarterly
fine with
meetings?
quarterly,
Okay.
except I'd like to have it at the facilities. I haven't been to all the facilities.
Right. You know, we do need to find some time where there are some facilities that the Santa Fe team hasn't had an opportunity to visit, so I think that's real important too. So maybe, we'll talk about that in a moment, the location. Tomas, do you have an opinion on that?
Opinion.
But with your schedule.
I appreciate the fact that we have been meeting on a monthly basis. I'm getting to recognize your faces.
Right.
Names is a little tough for me right now, but I do appreciate recognizing you.
You've been at every meeting. You've been religious about being here every time.
So thank you. I'm trying to represent the department efficiently. So I've learned a great deal also by understanding your reports, and I appreciate those as well. So I'm comfortable now to shift gears and go into a quarterly basis and participate that way as well.
I think as we were saying, we just want to make them, we want to look for opportunities as well, if we go quarterly, to make sure there's opportunities to improve the substance of the meetings and the quality of the dialogue. We'll look for those opportunities too. I know there's some things we have to do in closed session, but there's some things we could talk about in open one.
And I also appreciate the fact that I didn't have to drive to Silver City today.
Okay.
And that. It's driving back that's hard. Okay. Donna?
Okay, yes, I agree with the group. Quarterly boards would make more sense, I think, with the data that we collect. I agree with Anita about being able to do credentialings monthly if we can. And I'm for a common area for us to meet.
Okay. Louis, I guess representing Veterans Home today, or just your opinion personally, would you prefer monthly or quarterly?
Yeah, I think quarterly is a good thing to consider at this point. Just to touch on some of the comments that Ruby Ann made about the data and the data dashboard, our group is working to produce a data dashboard to have similar QI indicators for all the facilities. And so yesterday we decided that we would meet, Gail, myself, some of the other people to start looking and hammer out the data dashboard for each facility. So you'll look at those PI indicators and everybody will be able to review their own PI indicators at these meetings.
Okay.
Also, under section 9, administration and of the facility, looking at the content of what should be presented here via the administrator's reports, would be a good time to look at that, because what I saw was that there was inconsistencies in the administrator's reports. They're all sort of different. So if we look at standardizing that report, it would be more substantive, and we'd become, we'd be here with a lot of more substance.
Right. I know there, as I said a moment ago, there'd be some things that are appropriate for closed session, but I think there's more opportunity in our administrative reports in open session as well. I think that's what Ruby Ann was alluding to also in her question.
So I would just, at this point, maybe ask Gabrielle to consider looking at the section 9 for the requirements for the administrator's reports.
You're talking about the current or the old NMDOH bylaws?
These are the governing body bylaws.
Okay.
The new ones, the current ones.
Yes.
Which ones you were
For
referring
open or
to?
closed session?
Well, we'll have a discussion about what things we can talk about in open versus closed session.
Well, at least to use this as a possible model for the administrator's reports for the upcoming meetings.
Sure.
I think by history, the hospital or the different administrators have always we've been reporting stuff that we wanted to review and stuff that was sometimes not reviewed, so it'd be a good point right now to.
Right, standardize.
Yep.
Okay, great. So along with that, you said you're in favor of quarterly?
Absolutely.
All right. Yeah, I know you're brand new, but do you have a?
Yeah, I just had a question about approvals. If there is a high-level leadership, say it's a plan of care or an org chart or something that is from the facility perspective, how does that get approved in the governing board? Who approves that officially? Who's the?
I mean, if you have like an individual facility?
Yeah. Let's say, well, we just finished a new org chart for the veterans home. It's okay. After that's done, then at some point in time, the finality needs to be in a set of minutes somewhere that says this is done, it's approved, and it's approved by the highest level.
Sounds like your policies. I mean, with our credentialing committee, the flip side of our credentialing committee, we don't talk about those as much recently, but policies and things like org charts, policies, and others would be the flip side of what that monthly group meets on.
Okay.
And that would be rolled up into to the report that we do quarterly. So that could all be, that would just be built into that, I think. So all the facility policy revisions, we've been doing that already, so policies are going through your group as well. Gabrielle needs to look at them first, she always reminds me. That before we take policies, run them up, she likes to look at them first. So that's all incorporated into the monthly meetings of that policy credentialing group.
So if there's a facility, any kind of governing type of bylaws within the facility itself, or the org charts, or anything like that has to go through the credentialing, and then that's the final approval.
For that group, yeah, they're broader than
Quality
credentialing. It's
Quality review team.
The credentialing is just a piece of what they do.
We've not, historically, that I can remember, ever approved org charts at governing body meetings, and they've typically gone up through OFM because I think 99% of this is dealing with employees, and you have to, through the HR module, make some maneuvers. If you're changing your org chart, your reporting structure, all that's got to go up through personnel, so we've handled it
Same as a
differently.
Department of Health org chart.
Yes, but I'm just saying it hasn't gone to governing body.
That's right.
One of the good examples are reclasses that we're doing now, so do we need to bring those back through the?
No,
I
those
think
are all
just
personnel actions.
Picture.
That's not meant for a governing board, those are personnel actions.
So like the big picture leadership piece. In other words, so we know who is the leadership team in each facility, and who sits on what.
Those are all operational. Those are operational. Dr. Adams?
Oh, I think quarterly, we just gotta get the credential thing worked out. And we're in the process of doing that.
All right.
So we can still do that monthly, because.
That's important to do. Well, your whole quality review team will be important.
Well, we're gonna be meeting, that's outside of credentialing, that we're gonna be meeting too.
Okay, Gabrielle?
I agree that quarterly tends to be more substantive because you just have more time to actually complete some of the things we talk about at the board meetings as well. Sometimes I felt like we were meeting and I hadn't even had a chance to do the stuff we talked about.
Okay. Well, then on that first topic, we'll come back and talk about location second. We'll do each one separately here for a moment in terms of amending the bylaws. And I guess I would like to request a motion to change our governing board meetings from monthly to quarterly, starting with our next meeting. Would
So
that be
moved,
possible?
Mr. Chairman.
And a second?
Yeah, amendment to that is, are you gonna be having governing board meeting during the legislative session?
No. That
So
would,
so we gotta, should have a governing board meeting in December.
well, we can do
And
one
then-
in, if we do go to quarterly today, November, December, January. We can have one prior to the legislative session. Legislative session begins on approximately, I think, January 17th.
Yeah, we could,
So we can have a governing board before that.
okay, that's.
Then we would have another governing board April.
Yeah.
So that would actually work pretty good. You're right, yeah, during legislative session, it's pretty much 24/7.
Yeah, so I was just trying to throw that.
All right. We're trying
I'll
to,
second your motion.
okay, second the motion. All in favor?
Aye.
Okay. Opposed? Okay, the motion to change the governing board meetings from monthly to quarterly is approved unanimously. And that would, Gabrielle, I think, go into place then, so that we could do our next meeting in January? That'd be correct, okay. The second part of that.
Troy has
Sure.
Just a quick question in regards to like our fiscal year, how it runs July, August, September, October, November, December. Would we want to keep our reports on the fiscal year calendar quarterly, or not? Because then at the end, we could do a yearly report. So I mean, I'm kind of echoing, I think, what Dr. Adams was saying. If we had one in December, then we could start that process.
Or if you report in if the meeting's in January,
You
you
report on the last
quarter.
Yeah.
Okay, then that'll work too.
It gives us time to get the data.
Yeah, July, for instance, you'd be reporting
That makes more sense.
that last quarter.
Disregard my
So we'll
comment.
just ignore Troy. Like the marble.
As we usually do.
Business as usual, please.
Well, the second question is, would people, there's benefit in both. Maybe it doesn't have to be one or the other. It's not maybe so much, it's not really a voting thing in the bylaws, where we hold the meetings. I guess it's just more a question for the group. Maybe it's a combination of things. Rick is right. Maybe there's going to be some quarterly meetings that we would like to have in the facility. In the wintertime, it's a little hard, getting people to travel long distances in January and February, when I found out last winter myself, traveling around the state, around Klein's Corners and going up to Santa Fe. I couldn't get through there were several times last winter where I just couldn't get through or get through some of the passes. So that was a little tricky, So I think, we need to watch that in the wintertime quite a bit. But in terms of location, do people have I think we said that a little bit, do people prefer a central location most of the time, or would they like to continue rotating through the facilities? I'm fine with it.
I can see rotating around. If you stop here, you got 2 days of travel for 1 day of meeting. Yeah, it's cutting out a lot of time. I mean, I think that probably the difference between Albuquerque and Santa Fe, I think, is Mach 6 or 50 miles difference. But I think it'd be nice to go down to Fort Bear. I've been to Fort Bear. If you want to go down, that's a long damn drive, though.
It's a long distance, right?
And I would think a central location and do it the same place.
I'm feeling picked upon. It's
We
a
have to go
lovely
through
place
Denny
to
to
go.
get there. That's the trouble.
Well, yeah.
Well, I think primarily, I think the feeling is a central location, with the exception, I think we haven't had a visit to the Veterans Home. We haven't had a visit to Fort Bayard. And, based on when the weather is, I think we should, during the course of the next year, have one meeting at the Veterans Home, and one meeting at Fort Bayard to finish the cycle
Yes,
of
I would
visiting each of
suggest
the facilities. I think that's important, everybody get a chance to see those. But probably in the middle of the winter in January, this would be a good location for people, with that type of weather in the wintertime.
Or be better to have it at Fort Bear in the wintertime.
Well,
No, you don't want to do that.
I think
Is it
it's
snowing there?
point you're at on at least getting out to the facilities.
I think
once
that's
and
important.
central.
I think it's important to the staff to see us there too. There's opportunities more there too. I want to make sure, certainly when I'm at those facilities, I want to spend a considerable amount of time visiting with the employees. I don't think we've done enough of that either, so I'd like to make sure that I do that for certain. So there is some benefit in that. So I think the consensus is, it's not really a voting issue as much as a location. People prefer most times a central location, but with the flexibility of also having the opportunity to visit facilities, especially the ones we have not visited. Of course, here in Albuquerque, it's easy. If we decide to do a meeting, Turquoise Lodge has got some exciting things happening next year with their adolescent detox program. And when that is open, the board may really want to go there and see that, because that's a huge expansion of Turquoise Lodge Hospital with an additional 20 beds for adolescent. That'd be something that probably the governing board would be interested in seeing that. There's opportunities there to do that too. So it's very flexible, I think. And the last question, and maybe Gabrielle can help me with that, is the question to protect those that are not DOH members. All the DOH administrators, for instance, do need to vote on credentialing. And credentialing is important with our policies. As we make a decision to approve a new or reappoint one of our providers, there's always a possibility that issues could come up with that provider, and there's going to be legal issues and liability issues. And I think Gabrielle's thought was to protect those non-DOH members, if they were in an ex officio capacity,
Correct.
then they're still here, but they wouldn't have to vote on that for the record.
Correct.
Is that what your thinking is?
Yeah.
And in terms of that, just, I don't know, with the bylaws, we have a copy of that in terms of who is a voting member currently in ex officio? Do we have that
Oh,
there?
I think it was basically me that was ex officio.
But you're ex officio, I think,
I think everybody else was.
Tomas, I think you're ex officio,
Yes, I am.
and I think Daphne is ex officio. I think Secretary Ward is a voting member, and
Right.
Secretary Hale.
Right. They were.
And so I don't know if there's a lot of rhyme or reason to that, but
I believe Secretary Hill was a voting member because
the veterans,
of the veterans home, and the same thing with Fort Bear because of the 2 veterans units.
that's right.
There was,
I think Secretary Ward is a voting member as well.
I don't remember on that.
I believe so. Where is that in the bylaws? About
Yeah,
membership?
it's like in the.
Can you check that, Gabrielle, for a second? Can you give that to Gabrielle?
Sure. I was trying to, maybe you know it better than I do.
Well, see, these are NMDOHs. These are.
Oh, okay.
But they were based.
They changed significantly.
Okay.
We've modified it several times. I have one of the older versions.
No, I mean,
It
is that, need to
was
see
modified
our
again to
bylaws?
include Secretary
Do you
Hill.
have a copy of our bylaws for this today? All right.
It's a good time to
The
look at it.
secretary, the veterans person has been a long time. They were
At the Veterans
way,
Correct.
way a long time
I guess
ago.
we need to see ours.
Right.
All right. Well, I guess the conception, I'm not sure, I don't have a copy of our bylaws, I apologize for that, but I think I was accurate that, in who's an ex officio and who's a voting member. I do believe our CMO is a voting member and our CNO is a voting member. Our Chief Facilities Officer, when that person is hired, would be a voting member. I'm a voting member. Rick, you're an ex officio, I think, aren't you, or is he a voting member?
I don't remember that. I'm sorry.
Okay. And all the administrators are voting members. I believe Secretary Ward and Secretary Hal are both voting members.
That I know.
I think the cabinet, the deputy cabinet and deputy secretaries are both voting members.
Well, Jim would be an ex officio if he attends. He voted only, I think the way it was set up, Jim Green as a deputy would vote in the absence of the secretary, when substituting for the secretary. So if I was not able to attend the meeting and Jim represented me, then he'd be a voting member. I believe that's how it worked at that point. Okay. Sure, that's okay. I think, well, we can talk about that next time as well, I guess, but I'd like to look at the bylaws just to be 100% accurate. But the only change now would be we would, for I guess protection of people like Secretary Ward and Secretary Hal,
Correct.
we would discuss whether we would want to make them ex officio versus a voting member, so that when we talk about credentialing, they're not liable, or there's that, they're more protected, I think, right?
Correct.
So it doesn't change anything in terms of our discussion, but I think that's an important topic. We just need to, maybe we need to table it now to make sure that we all take a look at the bylaws and we're accurate on that.
Okay.
But that would be the concept. And I guess just in terms of discussing it for a moment, did you have an opinion on that, Secretary Ward, or?
Well, since I don't participate in anything that leads up to credentialing, it makes sense that I would not vote on credentialing
Right.
issues.
Yeah, you wouldn't be familiar with those
No.
providers or whether they're good or bad, or have a good feeling about that. All right, I'm sure probably Secretary Hal wants to be at the table in terms of the veterans issues, but I'm guessing we'll ask him next time whether he has an opinion about that topic. But probably, I'm sure he doesn't want to be in a situation where he feels liable either. Okay. But we have the right membership at the table. It's just a question of which category you have them in.
Correct.
Okay.
Absolutely.
So we'll make sure that'll be a topic of discussion at our January meeting, okay?
Okay.
All right. Thank you. To do what?
Just,
to take a look at our current bylaws and see what it says. You're looking at the,
NMDOH.
and that's those are not the rec bylaws, so.
No, yeah.
So we need to look at our bylaws.
But that report,
But add something about standardizing the administrator's report. Do you want to have discussion about that concept or just
We could do that in January also.
Okay,
I'll help you with that if you want.
okay.
There were a couple of things that may have fallen through the cracks with the changeover to the other bylaws, and one of them was our annual facility reports. There's some of us that have requirements to make an annual report that gets included in the bylaws, and then there was an annual, there's a board evaluation that has to come in.
We want to have more content, so I think when we, between now and January as administrators, I want you to, each of you to come back to me and give me a sense of what additional things you want in your report. I'd like to see more, not less, you know. I want to see opportunities where we can put more of that in, and some of that is individual to each facility, that, you know, but we want to do that.
Great.
So we want to, I guess, should we say, beef up or add more substance to our administrative reports, which I think is what Ruby Ann was talking about a bit earlier as well.
Do you remember why you were required? Was it a licensing requirement, or is it an annual governing body?
It depends on which facility it is, but some of them have annual, you have to give an annual report on safety or, there are nuances to this that people have to do their annual reports.
Okay.
One of the quirks, I mean, it was like last year for NMRC, and it's their specific requirement to approve their budget. And I mean, it just calls for a vote, so,
Right.
but there's.
Anything that you were doing prior, when we had the 7 individual governing boards that, you know, were requirements that you needed to do, we want to incorporate that into our consolidated governing board, so sure, be thinking about that for your individual facilities.
Okay, great.
We'll incorporate that in as well. If there's some things that have to be done and closed, you know, we just have to distinguish whether some of that is, you know, if it would have been done and closed when you had your individual boards, that would be the appropriate way to do it now. If it was done in open, that would be the appropriate way to do it now. So those are opportunities for discussion in January as well. Okay. Well, in terms of our current structure, you know, with our new business reports, why don't we do that, and you know, things that we can talk about in open, we'll talk about now. If there's some things you need to talk about in closed session, when we move into closed session later, we can do that as well. So let me go ahead and start with the facility administrator reports, and we'll start with New Mexico Behavioral Institute, which I think is on page 15. Page 15 of the report today. Troy, I guess just, you know, speak up loud, because I know we're broadcasting, so.
All right, good morning, everyone. Start off with the census for September. Our adult psychiatric division had 59 admissions, 49 discharges, with an average daily census of 84. Our adolescent unit had 2 admissions, 1 discharge. We've been running an average daily census of 9 for September. Forensics division, we had 14 admissions, 12 discharges. Average daily census was 71. Our outpatient community mental health program had a census of 1,557 in the month of September. And our nursing home had 7 admissions, 1 discharge, with an average daily census of 140. At the end of September, we were at 143. We went down a bit in our number of residents when we were doing the transition from the old facility into phase 1 of the new facility, and we're picking that back up now. And I think we're close to 150 as of today, and moving to 155. We have 5 residents referred to us.
Let me ask you a couple questions. I know Ruby Ann's probably asked those questions too, just for the group. Going up to the top there, when you have an average daily census of 84 in the adult psychiatric division, how many vacancies or empty beds does that leave you with then?
We historically run 84 operational beds. Given the high acuity and high number of admissions we've had over the last 2 years, we've gone up to being able to fill 99 operational beds. And that's due to structures. In regards to our cottages, we just opened Cortez Cottage after some capital improvement monies were approved to remove the ductwork from underneath the ground where it was sinking. We had no heating or cooling to the top of the building, and redid that. And before we had 99 was our total operational capacity we could have, and we've actually reached that within the last year at one point where we had no beds available for individuals to come in for.
So when you're at 84, you still have the ability, as necessary, you could admit more if you had to.
Well, we do. It's by statute, I'm not allowed to refuse anyone if they need the health, the care that we provide. We have to admit them. When we had the 99 and we were full, I had nowhere else to place individuals. We called all the emergency rooms that normally refer to us at night, told them if they're there, please stand down and keep them in a safe environment. We had some discharges going out the next morning, and we were lucky we got no calls that night.
Okay. And same thing with the care unit. When you say average daily census of 9, what would be full capacity there?
Full capacity 16.
Okay. And is it below 16 now because just the way cycles go? It's just
we had a lot of discharges at the end of or beginning of the summer, and we're starting to get some admissions coming back in now. Our adolescent program's been running around 9. It's been our average for probably the last 2 years.
That's so it's not that you're able to take more. It's just that there hasn't been the need for that.
Correct, and we actually reach out to our referring agencies and have been working closely with them to try to get more admissions.
That's great. Forensic we've talked about a lot here. I know that's a growth area for you.
I'm going to have to do the numbers and don't have them in my head all the time.
Well, that's okay. But I know that's a very busy area because what we described as our 1.5s, right?
Correct. And I didn't put the 1.5s on there. I think we're still running right at 38, and I think we have one pending 1.5. I can verify that.
Just reminding people that a major statutory requirement we have in Las Vegas in the forensic area is court required for competency, and we have a statutory duty requirement to take those. So that's always a challenge for Troy to make sure that we're able to take those in a timely manner, which you've been able to do.
We actually have today, there's a court hearing on a show cause order that we were unable to bring in a timely manner. And so Dr. Bagwell and I believe Hall from Office of General Counsel are in court today at 1:30 to explain that process and what our corrective actions are to try to relieve that. And that's been taking some of the beds that were over in the STOP program, 16 of those. We put up security fencing, waiting on cameras to be installed, and we will move some of those 1.5s into that 16-bed unit to free up space on the forensic main to be able to meet our legal requirements.
I just sometimes that's good. I appreciate that. It helps remind, I think, our governing board some of the challenges you have up there right now with those different programs.
Piece of cake.
Right.
Sleepless nights and a piece of cake.
On a real positive note with your construction, and that'll be another opportunity sometime in the future when phase 2 is done of your long-term care facility, that we'll want to go up there and have a governing board up there.
It'd be great. We'd love to have you. The construction has started. They are moving right along, and I think they're looking at a 14-month window to complete the phase 2 72 beds of our nursing home. And then we're going this session to ask for monies for phase 3, or at least the demolition of our existing meadows where we're going to build the phase 3 at. Our Sallyport, we have a very nice and secure Sallyport that's in place or going in place. They are finishing up with the security cameras and painting and stuccoing of that building, and we should be done by December and ready to occupy. We'll be contacting licensing later this month for them to come out and do their final inspection.
All right, great.
We still work with property control in a couple of areas to install cameras in the other patient care areas and looking at the roof and HVAC systems on our cottages, which I talked about earlier. We've done one building, it's called our Cortez Cottage. We have 4 or 5 other buildings, cottages, that need roof replacements. We think we have enough money to do probably 3, hopefully 4 of those roofs. We did 23 new hires in September, and we continue to utilize local tenant psychiatric coverage for our patients.
And Troy, while I'm thinking of it, we had mentioned earlier, I think Red mentioned about we have Legislative Finance Committee budget presentation next Wednesday, And in addition to our division directors, because they're looking close by and there's opportunities to get input, I'd like to have you and Anita and Michael be in attendance. That's
Wednesday?
That's next Wednesday, though it's officially at 10:30. 10 o'clock would be good.
Okay.
To meet over in the state capitol on the 3rd floor. You can get more, but we'll probably be talking with you anyways as we're preparing our presentation.
Okay.
But if you wouldn't mind, with your schedules doing so, I don't want to impose on everybody else. They come all the way up to Fort Bayard or something, but I think that would be very helpful if I could have the three of you there. I appreciate that very much.
Troy, Ruby Ann has a question for you.
Okay.
She said, what are the number of licensed beds for BHI, adult psych, and long-term care?
Adult psych licensed beds is 121.
176.
Is it 176 for long-term care? Thank you.
176
Yes.
for long-term?
I usually bring that with me. I don't have that paper.
And for adult psych?
Adult psych is 121 licensed beds.
Okay. Thanks.
Okay. Thank you, Troy. Any questions? Any other questions for Troy? Okay, great. Thank you very much. And Anita, I'll turn to you next for Sequoia Adolescent Treatment Center.
Okay, great, thank you. Census for September was at 27, average daily census actually run was at 27 too. We continue to work on a number of special projects. Re-roofing is almost complete. We did the first 2 lodges, A and B, and then the special management unit. And we're continuing to work on our painting project. We're about 88% complete with all the interior painting. We've still got a lot of trim work that has to be done, but I think we've got some repairs that have to be done as well. One of the things that we're going to be looking at, we've had a couple broken windows lately, and I think we want to really look at safety and moving towards plexiglass in some of those instances, and because we've got a lot of glass that's out in the courtyard.
I agree.
Materials for the emergency heating, the lodges has been shipped, and that project has actually started, and the fire riser room heating project has started as well. So we're moving forward with most of our buildings and grounds work.
Let me ask you just a couple of quick questions there. I know we have, it's very enjoyable governing board meeting we had there. I know that was a room that was an example of one of the rooms that you've done a lot of interior work on. And I know as all of us at governing board saw, there's still a lot of opportunities, and Nita's working real hard on that to change the ambiance or the look there, to make it look more therapeutic, not as sterile, I think. I don't know the right word to use.
More correctional right now, and I think we want it to be therapeutic.
So I think I'm a big supporter of that we want to just keep investing in changing the look there, because I think that's important to the teenage boys that are there, that we make that a much more therapeutic looking environment. So I really support that internally and externally. I know that's the look in terms of how we do things there. And in going back to your census, you have the 4 lodges, I think so. I guess if you were completely 100% full, would that be 36?
Yes. We're down for a couple of reasons. We've not had the number of referrals that we sometimes have, but we haven't been actively soliciting them. We're down a couple of people with corrections, with retirements, and our therapists are down by 2, and we are also in the midst of a culture change. I think one of the things that's really important to me, to a number of the leaders, are moving restraint reduction, and so we're focusing on that. And with anything, I think you have a lot of policy change, or not policy so much as procedural changes. And so as we move through this, we felt like we're better served to be a little bit less on the census right now. We have a couple of really tough kids.
Right.
And so.
And I know this is an opportunity, is with some of our new people on board now, like Dr. Adams and Gail Nash, that they've been helping you and giving you some support as well in terms of those changes that you're making, which are also, very exciting. I know Daphne, one of our board members from CYFD, wasn't able to be here today, but she's been very helpful in terms of working with us to our goal, which is a national goal of trying to be as restraint-free as possible.
Absolutely.
That would include both chemical restraints and physical restraints. So that's a very important goal that I support, as well as creating a more of a therapeutic environment. And now with our psychiatric coverage, we pretty much have daily psychiatrist coverage at Sequoia, which is another, I think, huge quality improvement to have that type of ongoing daily coverage.
Dr. Marin is serving as our medical director, and he's he's really been a leader in working with us to reduce our restraint seclusion. We've implemented some special procedures. We meet weekly to talk about any kind of a restraint if it occurred, what the antecedents were, and he's really leading the focus on this, and we're very appreciative of that. Dr. Bakhtiar is also there, and she too is providing excellent leadership to our group.
Well, you're doing a great job. I really appreciate your leadership there in moving in that direction. I think in working with CYFD, I know I was talking with the Cabinet Secretary for CYFD yesterday, and you know, I told her we want to work very collaboratively with CYFD as well, you know, in terms of that. So we all, you know, are feeling very positive about those changes.
We're actually, one of the new things that we've started as Dr. George Davis, who's a psychiatrist for CYFD, he actually manages YDDC, but he is going to be starting to come over and do some case conferences with us to talk about some of our more difficult clients and just to give us some input and feedback and sort of work as a liaison with the licensing group too.
Good, thank you very much.
Can I make a comment about, I'd like to make a comment about Anita's leadership. I've been really impressed with her rounding with the boys, and the staff see her, and rounding in classrooms, and she's very visible, and I think that is huge at making a change in the culture, and everyone recognizes her, which is, you know that she's out and about, so I'd like to publicly commend you for that. Yes, ma'am.
I think, Tomas, the education piece is, you know, is very important at Sequoia, and I think that's why, you know, chemical restraints are something you want to avoid it, you know, as much as you possibly can, not completely. Because you know, you need them to be focused on their education and other things as well. So the education piece at Sequoia is extremely important, as it will be with the adolescent detox when we talk about turquoise. So that's why it's good to have you at the table as well. You know, because education is a big part of what we do at those. We'll be at both facilities. Any other questions for Anita?
Let me just mention one thing.
I'm sorry I didn't let you cover your bottom part.
Well, that's okay. I think it's fairly self-explanatory, except that we, under the new positions, and we have a new medical secretary, which is tremendous to help with the workflow back there. A new financial specialist, but what we didn't put on there, Brenda actually started, Brenda Frank is our new clinical director, and she was an internal promotion. And Phyllis Denton, who was their clinical director for 20 years, retired. And so Brenda has stepped up. And I think the reason we missed it on here, she started actually the 1st of October, but technically she started the 29th of September. But
finance specialist, is that different? You also have a finance director?
This is yes, the finance director will be starting the 29th, I think it is. And that is the person that takes George's position, and this person is contracts and accounts payable.
Okay, so you have a couple other key ones as well.
We've had some long-term employees retire or self-select to not work there anymore for whatever reason, and so they've moved on. We've had a number of vacancies, and so we're very pleased with some of the people we have.
Okay. I guess I might be interrupting a little bit. You said on October 24th, you have your Staff Appreciation Day.
I will start it off with the breakfast thing and then be available to be in Santa Fe. It won't be a problem. But we have ongoing activities. We're actually partnering with the union. And so they're bringing in some of the things as well. We've got, people have donated a number of things. So we've also got drawings for prizes, door prizes for a lot of the different staff. An ice cream social that involves the kids that day, and so there's a myriad of activities starting with the night shift.
Great, that's going to be fun. That's going to be really good.
So yeah, but I'll still be able to be there.
All right, thank you. Okay, and I guess Mike, that's a good segue for Turquoise Lodge Hospital.
It's always tough to follow Troy and Anita. So I'm doing my best here. Again, we've had a pretty good month in reference to our census. We're back up to 33, right? Our capacity is 34 within the unit, so a couple days within the month that we don't fill the bed, and we drop down to the 33.3, I think is what we were this month. So we're basically full every day of the month. We had 42 admissions for the month of September. We've maintained on the MO2 side, we've maintained 45% out-of-county residents, with 55% being Bernalillo County within the hospital itself. That's not MO2, I apologize. So we try to keep that 50-50 balance between Albuquerque or Bernalillo County and the rest of the state, and we're trying to follow that for the year. On our medical observation treatment unit, the MO2, we're continuing to see over 300 patients a month, which this month we saw 320 patients. We've sort of changed, there's a little bit of transition going on in there. The contracts changed a little bit in reference to the dollars that we're bringing to the table. But also, the county is also bringing in a new program where they're bringing in a lot more patients coming in from the field, so to speak, with police officers bringing them in and dropping them off. And they're trying this new type of program to see if that sort of eliminates some of the waiting lines at the hospitals, at the emergency rooms.
Right.
So that's sort of a target population that the county's focusing on, and we're sort of subsidizing that through the MO2. So it looks like it's working out. We'll have some more numbers and we'll have some more information on that as time goes on. But it seems to be working well with the partnering that we're doing with Bernalillo County at the present time. Updates, again, the most exciting thing from Turquoise is that we're in the process of this adolescent program, 20 new beds. We're in the middle of construction. We just had the architects come in and do a review last week with the county. They're putting their proposal together. It seems like a lot of our items that we had issues with are going to get to be grandfathered in. We won't have to have too much hold up on that end. So we're excited about that piece. By the end of the month, we should have a report that gives us sort of the nuts and bolts of what needs to be changed and upgraded. And
I think just reminding people again, our goal still is on the first floor, two wings there to have 10 beds for adolescent boys, and a separate segregated wing downstairs, 10 beds for adolescent females. And upstairs, segregated from downstairs, we'll continue to have our 34 beds inpatient detox. So it's a 20-bed expansion of the hospital there, and expansion of staff as well. So I know we're working with getting those approvals as well, so we can have the additional monies to hire more people there and grow that program. We're also working with all these different partners. It's quite a collaborative process. As you mentioned that here, you've got a lot of acronyms on there. We're working with a lot of folks.
Definitely. We have everybody at the table that wants to be, whether they want to be or not, I guess I should say, they're all in there.
For instance, PED from the perspective of, well, if you have adolescents in there for a full month,
yes, sir,
we have to meet their educational needs as well, right? We're looking at different models to do that, I think.
Yeah, in fact, we had a meeting yesterday with a partner here in Albuquerque, RFK charter school, and they're looking at maybe participating with us. Again, I've gotten some good information from Tomas in the past. We're trying to collaborate and I've worked with Anita on some side meetings to try to figure out how we're going to, what's the best scenario with these kids coming in. They're not with us for a very long time, up to 30 days, but after 10 days, the way I understand it, they have to have some sort of educational curriculum set up for their programming. So again, we're trying to figure out, if it was only Bernalillo County, it would be a little bit easier to figure out, but again, we're bringing in kids from around the state, so it makes it a little more tricky. And again, those are the things that we're sort of going through on a daily basis to try to figure out what the program's going to look like overall at the end of the day.
Do you have any thoughts on that, Tomas? Or?
Well, there's, I shared with Michael the laws, the statute that states that the students should receive education, continuing education. And so I left it with him there.
And he's also given me a couple contacts that we have some meetings set up with, I think, a representative, and I can't place the name because I just got it a couple days ago from PED as well, to sort of give us some guidelines on how they set up a program. There's a couple different programs out there within Bernalillo County that we're trying to collaborate together. So again, I still have them on speed dial, so when I run into a roadblock, we can use Tomas as well.
I'm sorry, that's no problem, Michael. When you serve a student who has special needs, and most of your students might have that special need as a result of their disability, then you are required to follow special ed or IDEA regulation, which is the Individuals with Disability Education Act. And you also might want to keep in mind that if you get referrals from another area out of the county or even within the county, then the school is somewhat responsible for paying for that service and education. So just keep that in the back of your mind when you're progressing.
Good points you brought up.
Okay.
So again, we've had the education piece is a big piece. Experiential is another thing that we're putting in there, which would be offsite where they get to do rope courses, hiking, just some physical activity that's, I think, important with an adolescent population. I think Anita's sort of leading the way, so to speak, with some of those programs that are out there, and we're sort of piggybacking off of some of the things that they're doing. We've had the conversation with Santa Fe Mountain Center. Those guys are great. They're willing to come in. They're willing to serve our population. We've even talked about even adding some more time than they originally talked about. And you know, again, they're a great add to that programming. We're looking at some of the training that's going to be necessary for this new population, for the adolescents. So we're still meeting as a group with, you know, again, we have HSD, CYFD at the table as well, trying to figure out what's the best clinical version that we're going to be dealing with the adolescent piece. And we're going to need some training for that. But again, that's the cart before the horse. We're still trying to get the positions up and running, and I think that's the most valuable piece that yourself and some of the key people in Santa Fe are helping us get that pushed through so we can get those people on board, get them hired, and then be able to get them trained so that we can meet our deadlines that we sort of set for ourselves. So we're excited about those opportunities. There's a lot going on. We're in the middle of upgrading, painting, moving, getting furniture, all the little things that go along with the program, along with some of the bigger programming pieces that go along with it. So we have a committed staff. Again, we're a little short-staffed within the program, and we're adamantly trying to come up with new ideas. I just had a conversation with Ms. Gail Nash today to see if we can sort of take some different approaches and getting some new people on board. We did have the opportunity to hire 2 substance abuse counselors internally, which they're PRN positions, so we can put them in the spots that we need currently. So that's going to help with our adult population. But again, we're juggling the program that we're running today and then trying to add this as we go along. So we're busy at Turquoise. There's not a dull moment that goes on there. But we have a very committed staff, and I'd like to commend the people that have stuck with us there, because again, there's a lot of work, and they're really committed to making this new adolescent piece a success.
No, you're doing great with that. I mean, I appreciate all the hard work your team's doing on that. When I'm there physically looking at it, it's been a lot of work there. It's very complex, but we're making good progress.
Yes.
So I appreciate you being there next Wednesday, because I'm sure we'll get some questions on that, which is to be expected.
Yes, sir.
So we'll be prepared.
I know that, and again, ASD is Eileen and the rest of the group are helping us with making sure that the budget's intact and that it's all rolled out so that we get the money that we need. Rick's been a big part of that as well. So,
okay,
so
thank you.
Pass that along.
Any questions for Mike? From anybody? Okay. John at Los Lunas Community Program. Again, I'll talk louder so they can hear you on the recording there.
Related to Los Lunas this past month, our overall census has remained steady with services count of basically about 150 individuals and an unduplicated count of 80. We presently have 4 beds at present time that are vacant, but we are dealing with 3 referrals, both on the high need crisis and on health care, and also on the behavioral side. So we expect 1, 2, 3 to be filled shortly. We do need to keep 1 bed on each side for crisis situations, both on the healthcare side and then on the behavioral side. So that will get us up to about the capacity in existing leases of residential facilities that we have. So we're in process of converting two present leases to what we feel are improvements of the properties there. And we'll be looking at one more additional potential lease as our numbers continue to build there. On the human resources end of things, we continue to run a new employee orientation about every 6 weeks with Los Lunas. This last one was completed in early October with 14 new employees starting with us. Our next is scheduled again for November 5th. We've had 2 to 3 cycles of around 15 or so new employee attending. So our numbers are starting to build up on the direct care side, but that's a continuing need. We'll continue to address that. As was mentioned earlier, we're also involved in that reclass process of getting some positions re-identified there. We're also making one switch in 2 of our service coordinator positions that I think externally you could identify more as overall case management type of positions, but taking them over to a healthcare coordinator type of position to handle some of that day-to-day and the back and forths related to case management to hopefully reduce some of the burden related to nursing there so that we can be involved hands-on as many hours as possible with nursing for us. In terms of, it seems like this is time of year for some of these barbecues, breakfast, etc. for staff appreciation, basically. And we'll have a barbecue for our staff tomorrow. Be doing that at lunchtime there at our main facility for all staff. We also are waiting for staff from LFC and DFA to tour and to take a look at the training center, the old training center campus, to get present condition on that facility there. So
how is the condition of that facility?
There's been some demolition over the years. Now what we're running into is visually you can take a look at the buildings and see that there's been some downgrade of condition there over the years. But now what we're finding, since we still house state police, foster grandparent program, and some of our day program staff there, and also via correction substance abuse program there. Heavy use on our infrastructure, when I say that, water lines, sewer lines, that part of it, that we are starting to, my estimate, those lines, some of those, since Los Lunas was established in the mid-1920s, not sure what type of upgrades we've had to some of that. So we're taking a look at some collapsed lines, both on the water and the sewer line end. Just don't know the extent of that right now, but it is causing some problems.
Some very old infrastructure there.
Well, yes.
Okay.
Probably something that's older than I am out there at Los Lunas.
All right.
And that's my report, Brad, unless you have comments.
All right. We'll see if anybody wants to ask you how old you are, but
That'd be fine.
That's actually pretty neat lines, 1920s, that's good.
Yeah,
Have
it's all relative, I guess.
No way, 1800s?
I think it's like
Yeah, we
the
do.
early 19.
some of our facilities that, like you said, at Fort Bayard and in Las Vegas, we have some buildings that are older than that, that are on the campus. So we do have things that we have a responsibility to maintain as well. So there's a responsibility and cost in doing that too. Any questions for John? About
Yes.
this? Yes, Rick.
That building you were talking about, that's a state-owned building?
Say that again.
That's a state-owned building?
In terms of the,
Does property control run it, or is it privately owned?
it's property control.
It's property control.
It's all state facility, the training campus, the old campus. Is that what you were referring to?
Yeah, it's a big responsibility. probably when that time is lined up, I know some of our folks like Mike Brown and others want to make sure that we're participate as well. Okay, great.
Asking for capital monies to redo that. We actually have a study going on in our sewer line now that we're requesting capital monies for.
Starting to take a look. This is relatively new problem or coming to light.
Identified problem.
I'll probably get with you on that.
That's good. Absolutely.
You have a lot of properties like that, though. I guess, well, between Don and Louis, I guess you can both field questions here, but Louis, you want to go ahead? You can go ahead and give the New Mexico State Veterans Home.
Okay, the census is 123. Available beds is 4. 3 in Alzheimer's, 2 end of life, and 13 ICF and SNF. The pharmacy and the medical programs continue to run smoothly. Infection prevention, we had our vaccination clinic on October 2nd and 3rd. There's 78% of our staff vaccinated and 99% of our residents vaccinated. The elevator project is completed. There are no projects. This may be
This will be the last time the elevator will be mentioned here.
This will be the last time it'll be in print, that we hope. The recruitment, 1 financial specialist, 1 housekeeper, 1 nurse's aide, 2 nurse's aides, I'm sorry, and 1 was promoted from housekeeping to food service, 1 RN part-time. And then
we have a lot more. I know in the last month or 2, we've got a lot in the pipeline, but we've had a lot of CNA interviewing and hiring. I think mostly CNAs, right?
Mostly
CNAs.
We have multiple cooks and social workers and recreation, and yes, a large amount of CNAs.
That's good.
Yes.
They're in the pipeline going through various stages.
Yes.
Being oriented, hired and oriented, and prepared to be on the floor. That's very important.
Gail worked with Donna and Janet as well with reorganization and looking at the positions there and the availability of staff, and perhaps looking at creating a couple of positions also to help the management run a little bit smoother.
Right.
So they've been busy with that. So thank you, Gail and Donna and Janet.
We're very excited with Gail's look at our organization and getting our quality management very strong, and we're looking forward to that.
You guys did a good job.
Thank you. Did nip it a little bit on the nursing this weekend. I'm going to look at that and send it to you through email.
Okay.
It's the lower echelon.
Yeah. Okay.
Yeah. Okay. Good. Thank you, Gail has been, and Louis and Dr. Evans have been very helpful.
Right. I know all 3 of them have been spending a lot of time on site with you.
Yes.
At Veterans Home, so that's been very helpful in terms of getting a sense of how we're doing things and looking for opportunities to improve efficiencies there and staffing.
Yeah, and then Friday, I think we'll be able to tie up the quality plans for the quality metrics, so you can.
Fantastic.
Yeah, so you can start admitting.
Yes, I'm at Fort Baird, so I'll be calling in for that. Is it all possible at 1?
Yep.
Thank you, Gail.
Yeah. So really what we're going to do with that, if anybody's curious, is that we're taking the quality metrics that they're required to collect by and publish, and just taking those few metrics and putting action plans to those metrics, so we can see a trend line increase. They don't look that bad, actually. They look pretty good. There's a little bit, I think, too much variation in their data, which says there might be some process issues we need to get our arms around. But if we can prove and we can show a steady increase with that, I don't think there should be any question about the quality as it relates to admissions. So we should be good to go there.
Thank you, Gail.
Sure.
Okay, and I know you got some events coming up. I know the one I'll be coming to will be way of Veterans Day coming up already.
Yes, Kathy was saying there was a question on.
Oh,
Sure.
Ruby Ann just had a follow-up question to the number of licensed beds. She wanted to see if she can get a number on the number of licensed beds at Turquoise Lodge and at Fort Bayard.
Sure,
And
we'll
also
go with
long-term
Turquoise
care.
Lodge first. With the number of adult inpatient beds you currently have is 34.
Yes.
Long-term care,
Well, that would be it for
34 altogether.
34, that's what we're licensed for.
And for Bear?
We have 18 beds at CDU.
All right. Thank you.
The Veterans Day is November 11th, and Brad will be there to speak, and we're looking very forward to that. Unless you
Secretary
send
Hal
somebody
has so
else.
many, he would like to be there, he was
Yeah.
saying yesterday, but he's got about 39 events that he
Yeah.
has to attend statewide all at the same time,
Yes,
and he can't quite, so what he's trying to do, and I agree with him on that, is not go the same place each year, but to
Exactly.
make sure that he tries to, each year attend in places that he hasn't been before. So he apologizes that he won't be there at ours, but
yes. We
you
were
may have a
hoping that he
representative.
could send a representative. We have quite a few speakers, and
he plans on sending I think from Las Cruces or somewhere, he'll send a representative.
exactly, and all of y'all are welcome. It's a great ceremony, and we're very proud of it. We also have a car show right before that. We have all sort of antique cars that come the day before that are on campus, and it's fun, and it's enjoyable. The next door at the Vietnam Wall, they also have things that go on Saturday, so y'all come and see us. Then we went through our POWMIA Remembrance Day. We have wonderful organizations through the vets, and they come and they donate things. The last one, that the motorcycle group from Rolling Thunder Veterans Motorcycle, they brought us a little jukebox. It's digital. It's just like a regular little jukebox, but there's like 1,000 tunes in there,
Wow.
and that goes in our sports bar. So that's another thing that the guys like.
Gotta buy one of those.
Yeah, come and check it out, and that's fun. And more preparations for a Halloween party, so that's always fun. A little morale booster for our group. That's what we're trying to do. Thank you.
I think in terms of your projects too, I'm sorry, go ahead. Do you have a question?
Ruby, I just asked at Fort Bear, what are the licensed long-term care beds?
We have 200 licensed long-term skilled beds.
Thank you.
You're welcome.
Good. I know with your project, your major project, which is more next year right now, with your expansion.
Yes, exactly.
Probably
for
not
our
till next
new-
spring. I don't think we'll break the ground probably till spring of next year.
We're being positive that'll be next spring. I was at a meeting recently on the phone listening to the VA grant people. Next thing, we're 5th on the list. They do 30 projects a year, so we're very encouraged that we will be able to do that. And they also encourage that this shouldn't hold us up, the grants, that we could still go through with that. But I'm just listening and understanding that right now. So we're looking at Alzheimer's skilled facilities, and hoping to get the shovel in the ground next spring, like Brad was talking about.
Okay, great. Any questions for Donna or Louis regarding?
Yes.
I'm sorry, for the veterans home?
Oh, okay.
Number of beds?
Number of beds, there's 135 skilled long-term care, 10 domiciliary.
Okay. Thank you.
Okay, Janie from Roswell, New Mexico Rehabilitation Center.
Yes, for the end of September, census on the medical rehab unit was 5, and that's all we could have at that point because we only have one physical therapist in the building. In October, we started with another physical therapist, so we're looking at raising that to 10, and that's out of 15 beds. For outpatients, we had 2 active patients the end of September. With the new physical therapist, we'll add more outpatients as time goes on. For CDU, we had 15 patients in the building. We had 13 available beds. Part of that, we've had some issues with some AMAs and people not showing up, so it's a little bit hard to keep that census steady on that unit. Construction, Jane's Construction has been in the building, and they've been working on the major issue we had left with the building was our windows, and that's almost complete. So our brand new building is up and functioning. Recruitments, we hired 4 nurses and 1 medical records clerk. And in September, we've hired a CDU counselor, which is very helpful, and an infection control nurse this month. Yeah. So those have been very hard positions to fill.
And the counselors are critical with the census on the CDU. Right. To have an additional counselor. All right. And I know that's another area where we have another old building that, is heading at some point for demolition, but it's very expensive to do again because of the asbestos abatement. Right. But like in a lot of our locations, we have an old and a new, and down the street we have the old facility, which is always still a problem because it's tempting for people to break in that building. So those are all challenges we have in a lot of our locations. Trying to keep an eye on those buildings, but hopefully someday the funds will be there to demolish those buildings.
The last we had heard was Property Control was looking at putting a fence around the old building because it's old and all of the copper in there is broke into pretty much about every week.
Right. Okay. So any questions for Janie?
You did say 28.
28 on CDU and 15 on medical rehab. Thank you.
Okay, and then going back to Fort Bayard, Donna, we'll have you go ahead and give your official report.
Okay, thank you, Brad. We have, as of September 30th, we had 93 SNF and ICF residents. Of those, 29 were veterans, and that totaled 122 for our census. CDU at the end of September was 7. Of those, 3 were veterans. Then we have available beds, 3 on our long-term care skill and 5 on our CDU. Medical services continue to run smoothly with current provider staff. On-site lab and x-ray continues to operate smoothly. We are interviewing for a lab manager in the future. Arrangements to bring on-site dental to Fort Bayard Medical Center with Dr. John Sherman are proceeding. It takes a while to go through the system, but a draft provider agreement is circulating. The credentialing process has been initiated. Pharmacy service continue to run smoothly. Barcode scanner pilot will be started soon for our Quick Mart. The scanners will enable pharmacy significant quality improvement upgrades to our Quick Mart system and further reduce medication errors. And our staff is very happy with the Quick Mart system. Meetings continue with Gila Regional Medical Center to facilitate ongoing coordination and cooperation. I've been very positive and happy about that continuation. We have open communication now, and I think things have gotten straightened out pretty much. And if we continue on this way, I think we will.
Right, that was
continue.
A concern.
It was, and it was miscommunication all around. And I think with this new open communication and dealing with everybody and bringing them all to the table, that we're in a better position right now. Regarding CDU, the clients attended the Seat Lodge September 23rd. 2 of our psych techs have obtained licensures as a LSAA.
As a seat meet, must be a sweat lodge?
No, it is a seat lodge. It is a sweat lodge, but they call it a seat lodge. Don't ask me specifically. Adina is explaining this to me, and I'll get back to her. But she's dealing with a lot of different tribal organizations, and she's going to be going over to one place this coming month just to talk to them, because some of the tribal communities are coming back to us that have not come in a couple of years. So we're very much encouraging that. We're learning different things, because I don't have a lot of background regarding chemical dependency, so I'm learning as I'm going. So she's helping me out there. And Adina is now our new director of CDU.
Okay.
So she started the 15th, so we're very happy to have her there, and now we can post her position and get more people over at CDU. Infection prevention is going along very well. Flu vaccinations are underway for both the residents and staff, with over 80% of both groups vaccinated already, and that has improved. We continue to have clinics for flu vaccinations. Human resources, new student nursing A class began on September 17th with 11 students. They should graduate at the end of this month, and we'll get them on the floor, and that'll tremendously help us, and with a new class to follow right afterwards. We've interviewed facility administrators for Fort Barrett. The Assistant Director of Nursing interviews was scheduled October 10th. Human resource staff are planning fundraisers during the coming year in order to have morale booster activities. The first one is a pumpkin decorating contest for departments. And we'll do that on the 31st and have a nice party for the residents and staff at the time. We successfully recruited in September 2 food servers, a cook, and our CDU director. And we're going to have a Halloween bash on October 31st.
I guess, yeah, in terms you mentioned, that would be important to as we fill the facility administrator position, now allow Donna, what she's been requesting for quite a long time, to return back full-time to TRC, to the Veterans Home.
That would be great, yeah, that would happen.
So that we're working on that.
Thank you. Appreciate it.
Sure. You can chat a little bit more about that too afterwards, sir.
Of course.
See, any questions for Donna about Fort Bayard? State Veterans Home, okay?
Thank you.
Sure. I believe that is all of our administrative reports. As we said earlier, we'll use this time in the next couple of months to, you know, as we talk, the administrators and myself will talk about, you know, content, I think, in terms of the administrative reports. I think even today that we were trying to, I think, add a little bit of substance to that, I think, in terms of our discussion. So I appreciate that very much today as well. So I think I'll request a motion to approve as a group all of our administrative reports.
So moved, Mr. Chairman.
Second, please.
Second.
All in favor? Opposed? Okay, motion passes unanimously. Thank you very much. As we do each month, Richard Crespin is here from finance side, from ASD side, and he's going to give our program area 6 financial report, which is on page 22. So we'll have Richard up to talk up there too with the mic and everything.
Alrighty, the FY12 essentially has remained the same. The auditors are here this week, and by the time we meet, the audit should be done, and we'll have the FY12 numbers tied down. Although they'll be pretty much ready, I'd say latter part of November or early part of December for those of you who want to see those numbers. On the FY13, it's we're pretty much still projecting a surplus at this point. We do have the 50% statute that comes into play, so we have to be monitoring these expenditures that we don't exceed half of our budget. That happens every other year, every 2 years.
Right.
So at this point, we're okay. So that's, at this point, there's not much other than it's pretty much business as usual. Any questions?
Okay. Let me request a motion then to approve the program area 6 financial report.
So moved.
Second.
All in favor?
Aye.
Passes unanimously. And the next 2 sections are really combined, as we were talking about earlier. Maybe that's in terms of a quality review team. We do look at policies, we look at credentialing, so the team that meets monthly does look at both of those. I haven't seen a lot of policies come up lately. I don't know if we have any policies this month, but that is the proper channel. Actually, Gabrielle would be step 1, I think, who's also a member of the team, so that we're reviewing policies in a timely manner. But we do have credentialing to review this month, right?
Yes.
So I'll turn it over to you, Dr. Adams.
Okay, we have a number of them. We have 4 from NMDOH. Mr. Creston, who's a physical therapist, is reappointment. Alicia Sandoval is a social worker for reappointment. Ernest Hacker is an audiologist for reappointment. And Janet Espinoza is a certified nurse practitioner, psychiatry for reappointment. The Credentialing Committee reviewed them, felt all were worth reappointment. Would ask for a motion to approve those.
So moved.
Second.
All in favor?
Aye.
Opposed?
We have 2 individuals from Sequoia. The first is Diane Pallas, who's a doctor of psychiatry for reappointment. And then we have Dr. Marin is for initial appointment. He's a psychiatrist.
That's right. And Anita, I think you mentioned earlier that just slight typo there, it should be B-A-K
Yes.
for the first name of Dr. Marin.
Yeah, and Diane Powles is a psychologist, just for clarification.
Doctor in psychology.
Doctor in psychology.
Yes,
Okay.
we figured that out yesterday. The Credentialing Committee reviewed both of those and moved that they be approved and accept a motion for same.
Okay. I request a motion to approve both Diane Pallas and Baba Marin.
So moved, Mr. Chairman.
Second.
Second.
All in favor?
Aye.
Opposed? Okay, motion passes unanimously. I think in terms of, did you have anything else, Dr. Adams?
Again, we're going to sit down and we're going to break up this committee into a credentialing committee and then an ongoing committee for working on policy and policy.
Right, 2 sides of the same coin, but they're both very important ones. It has more of the immediate need each month. The other one is really doing quality improvement on our policies.
We're going to continue to meet each month, probably either here in San Antonio every month.
Okay.
Until we get all caught up on the policies.
All right. In terms of announcements, we'll firm that up, but I think what we're looking at is sometime earlier in January, prior to January 17th, to have our next government board meeting, probably here. That turns out to be a good location for people. And we'll also discuss at that time, the voting piece. We'll look at the bylaws again in terms of voting in ex officio. Perhaps Secretary Hale may be here at that point too, and have give his input on that as well. And we've been taking comments, but let me just officially, Kathy, in terms of open comments, open that up now and see if we have any additional questions.
Not at this time. That's it.
Okay. What we normally do at this time.
Secretary, I just
Sure.
have one question for the meetings that are prior to our board meeting. Are we still planning, so I can get staff available the 16th? Are we still planning the day before for finance? And
We changed that a little bit, but I think what we're doing is more incorporating in with all the travel time that it takes for that. I think what Rick was referring to earlier is that ASD, who kind of chairs that group, that team, we'll incorporate that into, we'll do it as a monthly call. Doesn't have to necessarily be the day before, I guess we'll have to think about what time to do that. So as we've done in the past, that'll be incorporated into an ASD call with all the facilities.
Perfect.
But prior to,
Yes,
we do it on a monthly basis actually, so.
Yeah, we're going to keep them on a monthly basis.
So they'll be meeting every
If we have
month.
to travel in, you can call.
So we'll make sure those discussions are going on, as well as our weekly facility calls, so, we're really doing it in a lot of ways, right? So there's ongoing communication there.
Good. Okay, thank you.
Sure. Okay. Let me go, I'm going to request a motion at this time to turn from open session to closed executive session where we won't discuss any personnel matters or vote on any issues that need to be voted on in open session. So request a motion to go from adjourn from open and go into closed
So
executive
moved, Mr.
session.
Chairman.
A second, please.
Second.
Okay, Okay, all in favor?
Aye.
Opposed? Motion passes unanimously. Thank you very much, and we'll go briefly back into open session at the end of close so that we have that on the record.